Funded project summaries usually do not sound grand in the way a fundraising speech sounds grand. They sound specific. They name who is served, what work will happen, where the work sits, and what evidence or output the funder can expect. When you read public award records, look for that specificity first. It is often the difference between a slogan and a grant-ready idea. For the example, use the NIH RePORTER record for the SWOG NCORP Research Base, administered by the National Cancer Institute. The public record shows a project title, project number, principal investigator, organization, dates, funding fields, abstract text, and related terms. It is not the full application. It is not template to reuse. Start with the limits. NIH explains that reporter data can be updated, and cost fields represent awarded costs for a fiscal year, not automatically the total lifetime cost of a project. Publications and outcomes also have their own timing limits, so use public records for pattern clues. Do not treat them as a secret formula, a complete budget, or proof that one phrase caused the award. The first specific move is the audience. This record does not only say cancer patients in a broad way. It points to adults, adolescents, and young adults, and people with or at risk for cancer. That matters because reviewers need to picture the population. A strong grant draft should make the same move, define the people clearly enough that the need, activities, and outcomes can line up. The second move is the lane. The record names cancer prevention, cancer control, and cancer care delivery instead of claiming to improve health in every possible way. That narrower language helps the project stay legible. In your own draft, avoid a mission statement that could fit almost any program. Name the part of the problem your project can actually work on. The verbs do a lot of work. The NIH record describes a research base that will design, activate, and complete studies. Those verbs are more useful than saying the project will support innovation or strengthen services. Work verbs tell a reviewer what the team will do after the award. When revising a draft, circle every vague verb and ask whether it can be replaced with a real activity. The structure is specific too. This public record points to a research base, a cooperative group enterprise, and a community oncology program network. That tells the reader how the work is organized, not just why it matters. A nonprofit grant can do the same thing by explaining the operating model, lead organization, partners, sites, referral flow, data flow, or service sequence. The record also points toward a proof path: studies, data infrastructure, patient outcomes, and research products. For a small nonprofit, the proof path may be simpler, but it still needs to exist. If you propose workshops, what will you count? If you propose case management, what will change? If you propose outreach, how will you know whether it reached the right people? Here is the translation move. A broad goal might say, improve cancer care for communities. Grant language asks for a bounded project: which communities, what care problem, what activities, which partners, what timeline, and what evidence. The funded summaries you study can train your eye to move from inspirational language to operational language without losing the mission. Start the rewrite with need. Instead of saying our community faces barriers, say which people face which barrier, where it appears, and what source shows it. The evidence might be local data, partner records, wait lists, survey findings, school records, clinic data, or another credible source. Specific need language gives the rest of the application something solid to answer. Then make the plan specific. A reviewer should not have to guess what happens in month 1, who is responsible, where participants enter, or what partners actually do. Use sequence language. Outreach leads to intake, intake leads to services, services lead to follow-up, and follow-up creates data for improvement. That kind of structure makes a project feel manageable. Specificity has to reach the budget. If the plan includes training, the budget should show who is trained, what materials or staff time are needed, and why the cost belongs in the project. If the plan includes data collection, the budget may need software, staff time, evaluation support, or partner reporting time. Costs should feel like consequences of the work, not a separate wish list. Outcomes need the same discipline. Name the output, name the measure, and name the timing. How many participants? What service completion? What knowledge gain? What referral result? What policy or workflow change? NIH guidance for public outcomes emphasizes clear, concise language for the general public. That is a good standard for nonprofit grant outcomes too. When you read a public award record, use a 4-pass teardown. First, circle the concrete nouns: population, place, partner, method, and deliverable. Second, underline the work verbs. Third, list the proof path. Fourth, write one sentence about what the record does not tell you. That last step keeps you from overclaiming while still learning from the example. Use this test on your own draft. If a sentence could fit any organization in any city, rewrite it. If the activity could mean 10 different things, rewrite it. If the outcome sounds good but cannot be measured, rewrite it. Specificity is not decoration. It is how reviewers understand whether the project is real, ready, and fundable. The bottom line is simple. Specificity builds trust. Public award records can help you practice seeing it, especially when you read them carefully and respect their limits. Name the people, name the work, name the structure, and name the evidence. This is the grant briefing. Find the funds, rate the winners, and write stronger grants.